Prasanna will be talking on the iStent Videocassette Pedagogy, an innovative teaching guide for mixed platform, like never before. Prasanna,
Can I start, sir?
Yes.
Can you reset the timer? Yeah.
The iStent Videocassette Pedagogy, an innovative teaching guide for mixed platform. The G1 series. The glide, the ideal implantation technique. Before implantation, it is imperative to identify the angle structures. Here we are implanting the G1 iStent into the trabecular meshwork with a proper gliding technique to ensure the proper placement within the angle. Following which, we can release the trocar and assist the stable placement of the iStent within the trabecular meshwork. A functioning trabecular outflow system can be seen by the blood flow within the collector channel from the position of the iStent. The cheese wire, the management of trabecular meshwork cheese wiring. Every trabecular meshwork has a different consistency. Here we have a case of a very friable trabecular meshwork with cheese wires on multiple attempts for implantation as seen here. The cheese wire, the management of trabecular meshwork cheese wiring. Every trabecular meshwork has a different consistency. Here we have a case of a very friable trabecular meshwork with cheese wires. The nudge, conforming the positioning of the iStent implant. Here we have another case of the G1 iStent which is being implanted into the angle with a proper gliding technique. Following which, we are not able to identify the positioning of the iStent within the trabecular meshwork as shown here. In such cases, with slow and controlled maneuvers with the dialer as shown here, the iris can be nudged gently to identify the scleral spur and identify the position of the iStent within the trabecular meshwork. The rebound, tackling the iStent rebound due to trocar malfunction. In this case, following the successful gliding implantation of the iStent into the trabecular meshwork, due to the trocar malfunction, the iStent rebounds during the opening of the claws of the trocar. So to properly reattempt the implantation, the iStent was retrieved using the trocar. And keeping in mind the trocar malfunction, the iStent needs to be released in a proper and controlled fashion as shown here. Once inserted, the claws needs to be opened completely before retrieving the trocar. Following which, the iStent can be gently tapped to ensure its stable positioning. G1 implant plus Cahook dual blade goniotomy, the combined mix. Here we have a case of G1 iStent implantation which was successfully implanted into the trabecular meshwork. Following which, an additional mix procedure was performed, the Cahook dual blade goniotomy on either side of the implantation at least 1 to 2 clock hours apart to increase the outflow via the trabecular meshwork. The G1 implant plus bang. Combined mix. Similarly, in this case, with the implantation of a G1 iStent, an additional mix procedure was done. Here we did a bent arm interno needle gonectomy on either side of the implant, at least 1 clock hour apart, to ensure an additional outflow via the trabecular meshwork. The G2 series. Dimpling and blanching. For proper placement of the G2 iStent, we need a proper dimple at the angle depicting good firmness to ensure that the iStent is well placed within the trabecular meshwork. And additionally, a second iStent is placed in the similar manner at least 1 to 2 clock hours apart. Here we can see the two iStents adjacent to each other via the limbus. Additionally, we can see an area of perlimbal blanching which depicts a successful outflow. Lost but found, correct method for retrieval of dislodged iStent. In this case, due to improper dimpling technique, that iStent was implanted superficially and hence the iStent was dislodged. Continuing the procedure, a second iStent was implanted with the proper dimpling technique. Following the implantation, an iStent retrieval was done by rethreading the iStent via the trocar. But as the sleeve of the trocar was not completely closed when removing it out of the wound, the iStent was lost. As we can see here, it is an empty trocar without the iStent. The iStent was found within the corneal wound. And again, a reattempt at retrieval was done by a rethreading of the iStent into the trocar. And this time, there was complete closure of the trocar by the sleeve before removing it out of the eye. Here, we can see a rethreaded iStent in the trocar. Following which, the second implantation of the iStent was done with proper dimpling technique, ensuring that the iStent was well placed within the trabecular meshwork. Here the data shows adequate reduction of intraocular pressure post-operatively. Practicing in the ophthalmic metaverse, the novel 3D simulator. With the use of hand tracking in the HoloLens, a simulated training module can be created. The 3D eyeball model gives a real-time simulation of the angle structures to practice the implantation of the iStent. During the simulated training, on proper implantation of the iStent in the trabecular meshwork, the indicator lights up as green. And this training improves the agility of the doctor for implantation of the iStent in the angle. Thank you. The iStent Videocassette Pedagogy, an innovative teaching guide for MIGS platform. The G1 series.
It's a 6-minute
The glide,
video, sir.
the
We are
ideal
just playing it again. Yes, sir.
Okay. We can't ask any questions.
Thank you, sir.